Good afternoon once again. Today is Friday, the 19th of February 2021, and this is the English language summary of the daily press briefing here at the Center for COVID Situation Administration, or CCSA, as always. So first of all, thank you to Dr. Bird, Dr. Pisamai, for the Thai language summary that we had just now about the situation today globally. I'd just like to put in a case in point that regarding the mortality rate, the death rate, in Thailand it remains quite low, which is good news. It's around 0.11% death rate only in Thailand, as compared to the mortality or death rate around the world, on average standing at 2.2, 2.4%. So that's still good news for Thailand. I'll move on to the general situation, number of cases that we have confirmed for today, which is 130 cases confirmed for today in Thailand, out of which 55 cases are from active case finding and 14 from those returning from abroad and currently in state quarantine. There was a question on social media about how about the rest of the cases. Of course, those are from the local transmission cases. So 130 new confirmed case. For the new recoveries today, we have a similar number, which is 124 new recoveries or discharged. Since the beginning, since last year, over 25,000 confirmed cases and 24,000 recoveries or those discharged already. So the numbers are almost meeting each other. We have 1,088 active cases right now, still under treatment. One information that I'd like to highlight, which is quite sad, is about the one new fatality we have recorded for today, making the cumulative number now standing at 83. So yesterday, Thailand, we recorded the first fatality of a medical worker, a physician actually, from COVID-19. Dr. Panya Han Panichapan, aged 66, treated COVID patients at his clinic in the province of Mahasarakam in the northeastern part of the country. He first treated a patient with high fever on the 13th of January, and on the 25th of January, he treated another patient with high fever, who was then diagnosed as the province's second infected positive patient. The doctor then closed his clinic and went into self-isolation. He was tested positive on the 1st of February, and he was admitted to Mahasarakam Hospital a day later before being transferred to a hospital in Khon Kaen province. However, his condition deteriorated and he passed away early yesterday morning. So our sincere condolences goes out to the family of Dr. Panya. And as we say quite often, the doctors, the medical team in the front lines, they're at very high risk. We appreciate their work and their sacrifice. And Dr. Panya is actually the first Thai physician to have succumbed to COVID-19. There are a number, around over two dozen medical personnel who have been infected positive with COVID, but this is the first death of a Thai physician. So moving on to the issue of Pathum Thani province, which Dr. Bird, Dr. Pisamai had mentioned, had summarized. So the Department of Disease Control had investigated the fresh markets in Pathum Thani and confirmed that the main factor of the spread of the virus is the bad ventilation, the insufficient ventilation system of the building structure. So the investigation team found that there were nearly no movement or no proper circulation of air in the central area of Pon Pat Fresh Market, and you have some images there, which increased the infection rates among the vendors working there. Another factor is the proximity of each vendor that accelerated the spread of the virus. And we might be having some maps coming up for you regarding Pathum Thani as well. So we'd like to urge all the markets to increase the rate of airflow by installing ceiling fans or ventilators to ensure the safety of vendors and the customers. And the local authorities have been informed, and these measures to be added to the various markets in the province of Pathum Thani will be coming in due course. So you see on screen some images, maps, satellite images from courtesy of GISTA, the geoinformatics agency, regarding the type of data and information that we're going through in terms of using the technology from satellite technology. So aside from Pathum Thani, the spread of the cluster from Pathum Thani is being carefully monitored so that it will not spread further to many provinces in the central region of Thailand. So that remains to be done. Yes, so I'll move on to the issue of the goals of vaccination in Thailand. And Dr. Apisamai had mentioned this yesterday. The Public Health Ministry proposed the detailed plan to the Special Committee on the relaxation of measures. So the general meeting of the CCSA on Monday, as mentioned, will then finalize the number of priority groups who will receive the jab in each province and set the guideline for further distribution when more doses of vaccines arrive and are ready to be used in the coming weeks. Now, in terms of province, there is no sort of priority. We'll be looking at it as a nationwide plan. So the Health Ministry would like to reiterate the goal of the plan. Firstly is to reduce mortality rate among the high-risk groups, which are senior citizens and people with chronic underlying diseases. The second goal, and there's a summary on screen for you now, is to protect the country's health system by providing protection for medical personnel and staff and authorities who come into first-hand contact with patients during work. And the third is to drive forward the economy and social activities of the country. This target group is the general public as well as workers in the service sector, the tourism sector, the industrial sector. The government is set to vaccinate everyone who resides in Thailand, regardless of their nationality, in order to create immunity to allow the country to have the protection against the virus in the fastest and safest possible way. So this is just a general outline of our goals in terms of the vaccination plan. And come Monday, many of the things proposed will be finalized and announced in due course. So I'd just like to mention about the researchers at Chulalongkorn University who announced that their mRNA vaccine named JulaCov-19 will soon enter the human trial stage approximately in the month of May. The team will cooperate with the National Vaccine Institute in conducting the trial among a group of volunteers in producing the vaccine, locally produced. This is a vital part of the goal to domestically advance the vaccination technology in Thailand and reach a sustainable vaccine security in due course. But rest assured that, of course, in the plan that we'll be having, and I mentioned that yesterday already, that the first tranche will be towards the end of February, the 24th of February to be exact, and the other batches to come in due course. So hoping for your cooperation and your understanding as we move on to the stage of the vaccination plan. As Samut Sakhon, the numbers are getting controlled, getting better through the active case finding missions. The cluster in Pathum Thani is being carefully monitored and actions taken. It's good that the highly congested city in Thailand, Bangkok, has not been meeting with high numbers in the past days and weeks. So hoping that will be better. And come Monday, we will be finalizing and approving the relaxation measures in this regard. So thank you very much for your attention. It's the end of the work week this week. We'll see you again during the weekend on Saturday and Sunday. สวัสดีครับ
กราบขอบพระคุณค่ะท่าน